Good day, everyone. My name is Alvia. I'll be educating my patients on typhoid fever. I'll start. Okay. Kube kazwane nami Alvia Danjuma. Wato obi mangi babo obi egitian bakoten kani be for be mozuena in a corner sesayana unchila yugo egawe ani be chopate be body ya shi lalo manajin gwaja wana kuma ya jama'tiyana unlawi ke oibe typhoid na typhoid no ma ejude tabangarin da chubais illa sai dai tabangare na galo mai suna ke no yi china be engi china daga anyani na ko kwai na ga anyani nan da mine ne je go typhoid ne bena kuma ina ya jawo gwana ga wannan kawai na sassara yana iga godolawe ila nu igwawe be chibena lawo na lana kawai sassara yana kala da yake fogu tana kuma ga tomi be chibena jawa ce da nyimbo ne ina wabiyo yin gwana ga wagabia da lafiya kin dogon na yiwa ga wayo shi ba wannan biya ebobo matan nan yayi jiwo amma wagawa guga ya jimo dole wa ji kula be nono ga ji amfani be ina gani be yangi na waga gina ari be kai ga be ba no ga lene da na ga ji arka be ina kuma kewa gan oke sana sasa ya da na kene je ya lioji o ga ke na doctor ban doctor ja ona ga no thank you very much.
My name is Muhammad Ismail Akolo. I have come to see my doctor with a complaint of vomiting, stomach pain, and shit. I used to stool. And my doctor has informed me that I have been diagnosed with typhoid fever after collecting my blood and shit. And my doctor has equally informed me that I will be admitted and treated with antibiotic, with painkiller, and I will equally be rehydrated because my body is weak. And after admission, if I'm discharged, I will be given some drugs to take home. And my doctor has equally informed me on the preventive measures, how to prevent typhoid fever for future reoccurrence, that if after treatment I still go back to eating dirty food or taking contaminated water, I will still go down with typhoid fever. And he equally informed me the preventive measures to be eating of good food, staying in clean environment, drinking clean water, and drinking of clean water. And thank you.
I greet you all. I'm talented medical student award winner of the quiz by the Soprano Doctor.
Seated here is the talented medical student award winner for the quiz by the Soprano Doctor.
Arthritis.
And he is going to be talking about arthritis.
And Igbo.
I would have to speak in a language you would understand easily.
Now, arthritis is inflammation of the joint.
Arthritis is the inflammation of a joint.
Inflammation now when you get injury for somewhere for your body, the place can swell up, it red and it pain you.
Inflammation is when you have an injury, it gets swollen, reddish, and painful.
Now that kind of thing wey dey happen for your joint, wey dem dey call arthritis.
Now that is what is called arthritis.
Now arthritis will happen for one of your joints or so many parts of your joint at the same time.
Arthritis can occur in one or multiple joints at once.
And the types of, we will talk about the two most common types of arthritis.
We'll be talking about the two most common types of arthritis in this
which are osteoarthritis and rheumatoid arthritis.
Which are osteoarthritis and rheumatoid arthritis?
Arthritis dey usually occur for elderly people, usually above the age of 65.
Arthritis usually occurs on elderly people from the age 65 and above.
And e dey more common, e dey happen for women pass the way e dey happen for men.
It's more common in women than men.
Now make we talk about the causes of this arthritis.
Let's talk about the causes of arthritis.
Now for osteoarthritis,
when
you get injury for your joint or infection for your joint,
when you get injured on the joints,
the thing go fit cause something wey dem dey call cartilage wey dey prevent your bones from touching together to break down.
It causes breakage of the cartilage.
Now for rheumatoid arthritis, e dey happen when your body immune system wey suppose fight against foreign objects.
It happens when your body immune system that is ought to fight against foreign objects
begins to fight against its own body tissues. Now, for the signs and symptoms of arthritis, I want to talk about the signs and symptoms of arthritis.
Signs and symptoms of arthritis.
You go feel joint pain, stiffness, and swelling of the joints.
You feel joint pains, stiffness, and swelling of the joints.
Now, how you want take know say you get arthritis?
Now, how do you know if you have arthritis?
The first thing wey you need to do now, if you get any of these symptoms,
first thing to do is when you have these symptoms,
you need to see a doctor first.
You have to see a doctor.
Now your doctor go fit collect your blood.
The doctor will take a blood sample
and he go use and check whether those antibodies wey suppose fight against foreign objects.
And he would make a research to know if the foreign objects
they fight against your own body tissues.
Are fighting against your own body tissues.
And your doctor fit also send you to go do scan.
Your doctor could also request for a scan,
such as X-ray scan, MRI, or CT scan.
Such as X-ray scans, MRI, or CT scan.
Then we could talk about how dem go take treat this disease if you get am.
We're going to talk about the treatment of this disease.
Now your doctor go fit give you drugs.
Arthritis could be treated by drugs.
Drugs such as painkillers. Or immunosuppressants.
Then
if the situation too serious,
if the situation is too serious,
they fit send you go surgery.
You could be sent in for surgery.
Thank you very much.
Thank you.
Good morning, my people. How una dey?
Good morning, everyone. How you doing?
Today, we wan yarn give una on top sickness matter wey dem dey call breast cancer.
Today, we'll talk about a sickness called breast cancer.
Breast cancer na the most commonest cancer sickness wey you fit see for inside women.
Breast cancer is the most common cancer seen in women.
Now, this breast cancer, out of 8 women, 1 woman fit get am for her lifetime.
1 out of 8 women can develop breast cancer at a point in her life.
So wetin come be this breast cancer?
So now, what's breast cancer?
Breast cancer na when the cells wey dey the breast no normal again, come dey grow so tey the body no fit control am.
Breast cancer is when the cells in the breast grow out of control.
And this cancer fit comot for the breast, spread to other parts of the body.
And this breast cancer can spread to the other parts of the body from the breast.
And when this cancer don spread to other parts of the body, na wetin oyibo dey call am say e don metastasize.
And when this breast cancer spreads, it is said to have metastasized.
Now wetin you go see for your body, wetin you go see for your breast, so you go know say this breast cancer don dey your domot.
Symptoms of breast cancer.
Number 1, if you see any lump wey dey your breast or your armpit wey no dey there before, na one symptom.
The first symptom is lump in the breast.
Number 2, if you notice say your nipples don go inside or they dey red, they don swell up, na another symptom.
Secondly, redness of the nipple or swelling up of the nipple.
If any part of your breast don dey pain you, your nipple don dey pain you, na symptom of this cancer.
The third symptom here is pain in the nipple.
Also, if you notice say the size or the shape of your breast no normal again, e don change from the way e dey before, na another symptom.
And when there is a change in the size or shape of your breast, it's possible to have breast cancer.
And if you notice say anything dey comot for your breast wey no be breast milk, something like blood, na sign say e fit be breast cancer.
Another symptom here is now abnormal discharges like blood from the breast.
Now, we never see anything wey be the particular cause of this cancer.
Now, we've not seen any particular cause of the cancer.
But e get some things wey we call risk factors wey fit put person in danger.
But we have things that we call risk factors that can put you in danger.
Number 1 na age.
First one is age.
Number 2 na your weight, the way you take fat.
Second one is weight, when someone is overweight.
Number 3 na smoking and drinking for among women.
3 is smoking and drinking.
Number 4, now women no breastfeed.
Number 4 is not breastfeeding.
Number 5, now if person get family history where people for the family don't get the breast cancer before.
The 5th one is in family history, when there is a case like there are people in your family that had cancer before.
Now we don't identify these things where they call risk factors. How we want contact reduce these risk factors so that we no go get this cancer for future?
And we'll talk about reducing risk of this cancer.
Number 1, make we dey try dey move body, dey exercise ourselves from time to time.
First one is constant exercise.
Number 2, the way we dey take fat, make we control am.
The second one is checking what you are consuming.
Number 3, if you be woman wey don born, make you dey breastfeed your children properly as e dey reduce the risk.
The third one is breastfeeding, because it will help to reduce the risk of this breast cancer.
Another one be say if you dey smoke, you dey drink, make you stop am or reduce the way you dey do am.
The fourth one is to limit how you smoke how you take alcohol.
Also, make sure you dey go doctor hand, dey do regular checkup from time to time.
And the most important one is to always go for checkups.
If you notice any changes for your breast, go tell your doctor.
If you notice any changes in your breast, go and tell your doctor.
This sickness, if they catch am early, they fit cure am.
If this sickness is not noticed early, it can be cured.
God bless you, my.
Alright, I'm so excited once again. It's another Saturday. My name is Isuma Hansen, a 500 level medical student of University of Port Harcourt. Shout out to Dr. Oge CV over there in the UK and other doctors in the US that are our mentors. So I'll be explaining hypertension in Pidgin. So I'll be switching my language mode now. Hypertension for Nigeria, we call it IBP. Normally, normal blood pressure now 120/80. But when the thing don't they reach people to get that 140/90, we come call the toxic boy. This thing don't the person don't they get hypertension no. And why would they talk about that now? Because plenty people for this world, almost more than 1 billion, they hypertensive and make how many would they for this world now where some people blood would they flow like kg down. And make would they talk say people take care of themselves. So hypertension is silent killer. Sometimes they show say the thing day or the thing will give you small signals sometimes like chest pain, headache. Sometimes all this your sensation for body if they malfunction small and the small sign wey hypertension will give you. Another thing be say hypertension e get so many kind way e fit cause. So e carry e dey burn small, e dey do small things wey people no dey fit understand but wetin we dey call cardiovascular and renal morbidity and mortality. Wetin make say we suppose dey take care of ourselves. So wetin dey open door for hypertension na wetin we dey call risk factors. Wetin dey open door na one first one wey we go talk about na age of people wey don old well e fit go dey enter hypertension. Another thing na gender o, male na another thing wey dey cause. If you be male e dey possible say you go fit dey get hypertension pass the female people o. Another thing na same thing dey run for the family o. Another thing na whether whether you be black or white o. If you be black, mean say you fit dey possible say you dey more exposed to say your risk factor, the possibility say you will get IBP e dey for your side o. Na so the thing do. So how we go manage this thing now? How we go do so that we no go get this thing now? First thing we go do be say we first dey try to dey eat better food o. Stop to dey smoke, stop to dey drink alcohol. All these people dey drink. Stop to dey drink too much o. We dey exercise well and we dey eat good food. We go reduce the number of salt wey we dey take for our food o. Because salt another thing wey go expose us to IBP. Na so the thing be o. How we go use treat the thing now when you get. First of all, we go see our doctor for regular checkup so that as I don talk, hypertension na silent killer. They give signal sometimes, but we go see our doctor anytime we see we dey run around, they go for side chemist, they go treat ourselves. We no stop self medication because hypertension dey look for face o, na silent killer. So now I go allow the person wey I dey with making use better English explain wetin you understand from wetin I talk about IBP.
My name is Isuma. From what he has explained, the normal blood pressure is 120/80. Whenever there is deviation from this normal to 140, over 90. That shows that one is hypertensive. And there are several causes he had mentioned about hypertension. Hypertension causes pains in the kidney, in the body, and even a lot of disorders which one cannot envisage. But there are persons that suffer hypertension more, the aged persons. When somebody has so much age, even genetic factors such as or family history, when somebody is affected by hypertension in the family, there is tendency that other members of the family are to be affected. Also, race is another factor that that causes hypertension. Over 1 billion persons in this world, as he explained, are hypertensive, whereas the population of the world whereas the population of the world compared to the number of hypertensive persons is so much. There is need for hypertension to be taken care of or treated. One of the ways hypertension can be treated is by avoiding the things that causes hypertension. Some of the causes are food, the food we take, that is the nutrition, as well as the exercises. The absence of exercises are the things that causes hypertension. Also, lack of keeping to doctor's instruction whenever we are instructed to do one thing or the other can also lead to.
Good morning, my teachers, mentors, colleagues, and viewers. My name is Ibrahim Shitu, a student doctor from Usman Dafur University, Sokoto. This is my cousin, Mohamed Ibali, an engineering student. Today, I shall be discussing yellow fever, which is an health condition in Yoruba language, we interpret in English language. Ìgbà tá fẹ́ sọ̀rọ̀ lẹ́yìn ìgbà ìpọ́njúpọ́ntó lórí àwọn ìlà.
We shall be discussing yellow fever based on the following outline.
Àwọn ìlà yẹn náà ni ìfihàn òkùnfà àìsàn, ìtọ́jú àti ìṣọ́ra.
These outlines are the introduction, the causes, the mode of transmission, the symptoms, the treatment, and the prevention.
Ìfihàn rẹ̀, àárẹ̀ ìgbà ìpọ́njúpọ́ntó láàárẹ̀ tó ń dààmú ẹnikẹ́ni tí ò jẹ́ àjẹsára ẹ̀ tí ń gbé ní ilẹ̀ òrùbílẹ̀ Áfíríkà. And àwọn ìtàrẹ̀ mọ́ ń dààmú jùlọ àwọn ọmọdé àti àwọn àgbàlagbà tí ń ti darúgbó. Àwọn World Health Organization wọ́n ní pé àárẹ̀ yìí pé ó lè pé èèyàn 84,000 sí 100,000 òun láàárẹ̀ máa ń dààmú lọ́dún. Nínú àwọn ẹni bí èèyàn 29,000 sí 50,000 wọ́n máa ń kú lọ́dún.
Yellow fever is a viral health condition that affects unvaccinated people living or visiting tropical regions like Africa. This particular health condition does not have an age limit, but affects people of all ages, most especially the younger children and the older adults. Even World Health Organization estimated 84,000 to 170,000 infected population annually, of which 29,000 to 60,000 die at the same time.
Okùnfà àárẹ̀ yìí ni kòkòrò ajẹnirun tí ń pè ní flavivirus.
The causes of this health condition is a species of virus called the flavivirus.
Ọ̀nà tá ń gbà kó àárẹ̀ ni àárẹ̀ fún tó jẹ́ tó ti láàrẹ̀ tó tún wá kó ẹni tí ò láàrẹ̀.
The mode of transmission is as a result of mosquito bite from an infected person to an uninfected person.
Ìtọ́jú àwọn àìsàn tí mọ́ ń fà sí àárẹ̀ tó ti ní àárẹ̀ yẹn ni orí àwọn tí ń láàrẹ̀ yẹn mímọ̀ pé àwọn ṣe láàrẹ̀ yẹn, àmọ́ àwọn ẹnìkan ara ẹnìkan lè mọ́ gbóná dáadáa, àwọn dẹ̀ tún lè ní ara ríro, àwọn ẹnìkan ara wọn lè mọ́ ojú wọn àti ẹnu wọn lè mọ́ ṣẹ̀jẹ̀, àwọn ẹnìkan wọ́n lè ní ojú funfun.
Most of the infected patients of this health condition are asymptomatic, of which they lack the idea that they have this particular virus in their body. Some patients tend to have flu-like symptoms which subside over time. Some develop high fever and body aches. Some tend to bleed from their mouth and nose, while some have jaundice.
Ìtọ́jú tó yẹ kéèyàn ṣe fún ẹni tó bá láàárẹ̀ kò sítọ́jú pàtó tó wà, àmọ́ tí èèyàn bá ṣàwọn ìtọ́jú yìí ó lè jẹ́ kó lọ́wọ́rọ́. Àkọ́kọ́ ni kéèyàn gbẹ́ni yẹn lọ gbà.
There is no specific treatment for yellow fever, but can be managed by first taking the person to a hospital.
Ìkejì ni omi ara gbígbà.
By rehydration.
Ìmíì dẹ̀ ni ẹ̀jẹ̀ gbígbà fẹ́ntẹ́jẹ̀ rẹ̀ bá ti dínkù.
And also by blood transfusion.
Ìṣọ́ra tó yẹ kéèyàn ní àkọ́kọ́ káyé kéèyàn bí téèyàn ń gbé kó mọ́.
One of the preventive measures are by keeping a safe and clean environment.
Ìkejì ni kéèyàn jàjẹsára ẹ̀.
By proper vaccination.
Ìmíì dẹ̀ ni kéèyàn wọ́gbọ́n dá sí àyíká ibi táwọn ẹ̀fọn máa ń gbé.
And also by eliminating sites where mosquitoes do breed, thereby resulting in spread of the virus.
Thank you, my viewers, mentors, and colleagues. This is a brief about yellow fever. Please support me by liking.
Right, Jane, this thing I want to teach you like this about blood disease. Importance of going for antenatal, especially women when they agree go antenatal and women when they do abortion. The most important thing we say, we always advise women say maybe they go hospital, maybe they go check when they're pregnant. Why? Because of this blood disease for newborn and picking way for belly. The most important thing we say, if Rhesus negative woman they pregnant with Rhesus positive child, for instance, at first that picking the day alright, but subsequent pregnancy, when the picking still be Rhesus positive, that picking no go dey alright again. Why? Because the blood of the mother go start to form serious chemicals wey go attack the picking. In such a way we say such picking now they born now, they know they dey alright again. Most especially they get severe lack of blood. Another thing be say they fit die inside the woman belle sef. And at times they fit get brain damage, permanent brain damage. So because of all these factors, many people know the thing say na village people they follow them, as the case may be. Now we say it is very necessary now make women and girls maybe they go for antenatal when they pregnant, and also girls when they do abortion, especially illegal abortion, for instance, we know they know whether they picking with their own Rhesus positive. If they abort that picking, subsequent pregnancy or maybe during marriage in time to come, they will get serious issues too. So because of that, we always advise girls may they go hospitals, check up themselves, take medical advice, and women too may they go hospitals, check themselves up, ensure say that they're free from all those diseases, so that the picking when they go born they go always be alright. I just this small things I want to tell you, sure, I don't finish.
Good afternoon to you all. My name is Pidgin, and I would like to brief you all about the importance of going for antenatal checkup during pregnancy in relation to the hemolytic disease of the unborn and the fetus. Now, it's very important for a pregnant mother to always go for antenatal checkups so as to know her health status and that of the unborn child. Like over 80% of deaths are mostly caused by ignorance of a mother who failed to go for antenatal checkup. Now, if you as a Rhesus negative mother is pregnant with a Rhesus positive child, for the first time, the child will be safe and healthy. That is without antenatal. But on subsequent pregnancy, the blood of the mother now attacks that of the child, which can result in the following. 1. Severe lack of blood, which is known as anemia. Then 2. Brain damage. Then 3. Death of the unborn child. More so, a Rhesus negative female who have aborted a Rhesus positive child stand a chance in high chance of what? Of suffering the same fate as that of the unborn child. Okay? So now what I'm trying to say in conclusion, in a nutshell, is that as a pregnant mother, ensure that you go for medical checkup, that is antenatal, and also try and flee from abortion, which will help you to give birth to a healthy child. So thank you all for listening.
Ladies and gentlemen, my name is Abdullah Mudassir Muhammad, a 600 level medical student of Usman Danfodio University. Here with me is my friend Abdul Rashid Muhammad, who is a friend. I will talk about this condition called diabetes mellitus in Hausa dialect. Ina kwanan ku ya ku ɗan uwana maza da mata, zai magana kan rashin lafiyar da ake cewa ciwon suga.
Good morning, ladies and gentlemen. We are going to have a discussion on a disease condition called diabetes mellitus.
Wato shi ciwon suga yana faruwa ne in jiki bai iya kinkira wani sinadarin da ake cewa insulin. Ko dai bai iya hidda shi ne, ko dai yana fidda shi amma ba ta aiki a cikin jikin mutum.
The disease condition occurs when the body cannot be able to produce a particular substance called insulin, or when the body can produce the insulin but cannot be able to use it adequately.
Wato kuma shi ciwon suga akwai iri-iri ne, kusan iri hudu ne. Na farko ana ce mai ciwon suga na daya, kuma shi yana faruwa ne gaba ɗaya jikin mutum bai ma iya kinkira na sinadarin da ake ce mai insulin.
This condition is of different types. It is been classified to different types. The first one is type 1 diabetes mellitus, and it is one that occurs when the body cannot be able to produce the substance insulin.
Shi kuma na biyu din, jiki na iya kinkira insulin din, amma in an fitar da shi, jikin mutum ba sa iya amfani da shi.
The second one is the type 2 diabetes mellitus, and it occurs when the body can be able to produce the insulin but cannot be able to utilize it appropriately.
Na uku kuma shine rashin wanda shi ciwon sugan da ake samu cikin mata masu juna biyu.
The third one is the one we call the gestational diabetes, and it is one that occurs in pregnant women. They can be able to produce the substance, but they cannot be able to utilize it.
Wato shi kuma na hudu, shi kuma akwai abubuwan da dama da suke kawo shi, amma saboda lokaci ba za mu yi bayanan su ba.
And the fourth one is one we classify as others. Time will not permit us actually to discuss much on the other types.
Ana cewa mutum na da ciwon suga in ya zo asibiti an auna sugan jikin shi kuma ya yi yawa, yana da maki 11.1.
A person is being said to have this condition called diabetes when the blood of the person is being tested to have a sugar level greater than 11.0 millimole per liter.
Ko dai an ce azumin awa 12 kuma in yadda an ka auna kuma ya wuce maki 7.
Or the individual is being asked to fast, and after being fasted for like 12 hours, his blood sugar is being tested to be greater than 7.0 millimole per liter.
Kuma tare da wayan ga aune sai ya zo da yanayi da ya zo asibiti, za a duba yanayi kamar ɗaya a ce yana yawan shan ruwa, ko da yana yawan fitsari, ko da an ga alamun cewa yana ramewa.
And apart from the other test, the person also come up with some presentations to the hospital, such as excessive weight loss, excessive urination, and also excessive drinking of water.
Alhalin abubuwan da suna faruwa ne in mutum ɗaya a cikin gidansu akwai mai wanga rashin lafiya da ake ce ciwon suga.
Of these factors that come up that make the individual to come up with the disease is when they have the family history of the condition.
Ko dai akwai cutar da ya shafa shi wannan injimin da ke fidda wannan abu da ake ce mai insulin.
Or maybe there is a disease condition that affects the substance that produces the insulin, and that is what we call the pancreas.
Ko dai in mutum na da kiba da yawa, kiban da ya wuce ana ce mai maki 30.1.
Or maybe the person is obese, maybe having obesity of BMI of greater than 30.0.
Kuma alhalin in mutum ya zo asibiti akwai maganukan da ake bada daban-daban, amma lokaci ba zai babu damar da zamu bayanan maganukan nan ba.
And there are drugs that are being used in the treatment of the disease condition, but time will not permit us actually to discuss on these drugs.
Hanyoyin da ake bi a kiyayewan ga rashin lafiya su ne ɗaya, mutum ya rage kiba, alhalin mutane da suke kiba da yawa. Biyu kuma a dinga motsa jiki akai-akai, akalla su 3 ko su 5 da sati. Na uku kuma shine a rage cin abinci masu zaki da yawa, ire-iren su coke haka da abinci da ake da fulawoyi.
The ways an individual can prevent themselves from getting the disease is as follows. Number one is weight loss, or let's say diet control first, and we have exercise, and we have control of obesity or weight.
Thank you very much. Alhalin daga yanzu mun zo karshen maganar bidiyon ga. Thank you very much and God bless.
Good morning, everyone. My name is Maiden, your favorite Nigerian medical student from level medicine and surgery, Hausa University. Okay, I'm doing my own video challenge in response to Dr. Ogechi's video, okay, to teach someone in a local language this condition. So I'm teaching obesity. So please introduce yourself.
Good morning, everyone. I'm Jakari David. So I'm here to learn about obesity from a doctor friend.
Okay, I'll be using Pidgin English which is a common local language. So when I'm done, he will interpret to you in English. Okay, the thing I will say, obesity is disease. Disease will be saying sickness. Now be disease, now sickness. Also, we say the cash they do person. So this sickness now person will be say you will get excess body fat, the body too big. You understand? You will get say body be heavy and you don't feel the waka well. Then you will get what they call a BMI, which is body mass index. So like say if they want rate, if they want talk, say okay, how weight be, how the person take heavy reach, and how it take tall reach. And if they want compare the two, then they call BMI. You understand? So if the person will pass 30, then they call obesity. Once you reach 30, go up, then be obesity. And this obesity is not good because it cause many sickness. It lead to many sickness. So if you say like hypertension, so if like say person he has good beat, boom, and then the hypertension, then obesity lead to too. Then another thing they say they lead to diabetes too. So the thing we will do, we say to avoid them, we do exercise, and we eat food like vegetable, and you eat food, not we eat food we get contain fat like that. No go to eat all those food, all those yam, no go eat all those ones like that. You will do your exercise, and that's what it be. So all these things where I don't teach you, so if you tell the viewers for English.
Okay, according to what my doctor friend said obesity is a disease. It's a disease condition in which there is excess amount of fats, excess amount of accumulated fats in the body. So obesity is usually calculated in terms of the body mass index, and the body mass index is like a relation of the body fat to the height of the individual. So the body mass index greater than 30 kilograms per meter square is said to be obese. So it's actually a disease condition, and it has a lot of complications associated with it, like diabetes. Diabetes, for example, whereby there's high level of blood, high level of sugar, high level of glucose in the blood, even hypertension, osteoarthritis, and depression. So these are some of the complications that might arise from being obese. Also, from what he said, lack of those are some of the complications. There are also risk factors. You may mention of some risk factors that could predispose one to have or for one to be obese, and some of those risk factors include having a sedentary lifestyle, as not exercising at all or not exercising regularly, unhealthy diet, genetic predisposition, and some other risk factors like that. Thank you very much.
Okay, thank you very much.
Good day, my colleagues. My name is Muhammad Mukhtar, and here is my colleague, and I'm from 600 level of Usman Danfodio University, Sokoto, and I'm here to talk about the importance of premarital screening and using my own native language, which is Hausa. And here is my patient that is going to interpret it to English. Muhammadu, zan gaya maka ma'ana amfanin gwaje-gwaje da ake yi kafin ma'aurata su yi aure. So wayannan gwaje-gwaje amfanin su ana yin su ne domin a tabbatar da cewa wasu cututtuka wa'inda ko mijin ko matar za su iya samu junansu idan suka yi aure ta dalilin misali auratayya tsakaninsu mu'amala da za ta shiga tsakaninsu ta aure za su iya sanya ma junansu, wanda idan suka yi auren ba tare da sun sani ba zai iya kawo ɗaya daga cikinsu ko kuma su duka su kamu da wannan cuta. Sannan kuma yana ƙara taimakawa wajen hana wasu cututtuka waɗanda suke da su wanda za su iya sanya ma 'ya'yan da za su haifa misali. So amfanin waɗannan gwaje-gwaje shine idan aka yi su ana samun gano cewa lallai waɗannan idan suka yi aure za su iya samun cuta tsakaninsu kuma za su iya haifar yaro da ita. So amfanin su sai a gane sai a guji wannan abun a kiyaye shi, shine ake ce ma gwaje-gwajen da ake yi kafin aure. Waɗannan gwaje-gwaje sun haɗa da gwajin da ake yi na gano mutum na da cuta ta HIV ma'ana cutar kanjamau, akwai kuma ta Hepatitis B and C wanda muka yi sani da ciwon hanta, sannan kuma akwai wasu wanda ake yi kamar misali wanda ake ana gano idan akwai mutum ma'auratan suka yi aure za su iya haihuwar yaro wanda ke da sikila da kuma sauran makamantansu. So amfanin waɗannan gwaje-gwaje shine idan kuka yi su za a tabbatar da cewa mutum zai iya ɗaukar wannan cuta sai a samu sai a kiyaye. Kamar yanzu misali muka ɗauki wannan cuta ta sikila da ake ta magana ana ta yaɗawa. So wannan cuta ta sikila za ku ga cewa idan mutane ba su yi wannan gwaji ba suka yi aure za su haifi yaro wanda sai ku ga duk bayan sati biyu a yi ta zuwa asibiti a yi ta magani, yaro bai jin sauƙi, a yi ta kashe-kashen kuɗi, aure ya zama babu daɗi, kai miji da mata ba ku ji daɗi ba, shi yaro bai kwanta hankali ba, ya zama har ma abin zai iya taɓa ƙwaƙwalwarku da ya shiga rayuwarku ta auratayya ya zama yana kawo muku matsaloli da yawa. So shi sanya ake ta cewa ya kamata a dinga yin irin waɗannan gwaje-gwaje. So in kuka ga kaga kenan ya kamata a ce duk wani wanda zai yi aure ya yi wannan ainihin gwaje-gwaje domin kiyaye wannan abin da za a iya samu. Ko kuma misali wannan cututtuka na HIV da cutar ƙanjamau da ciwo na hanta, idan baka yi gwaje-gwajen ba ka je kuka yi aure ka ɗauka ka sanya ma matarka ko kuma kika sanya ma mijinki, zai zama cewa kun samu matsala abubuwa tsakanin ta auratayya. Misali za a zo a yi ta rigima, iyayen mata suna cewa a'a mijinki ya sa miki, iyayen miji yana cewa a'a shi suka sanya shi ya sanya miki. So because saboda wannan abubuwa muke so dan Allah a dinga zuwa ana yin waɗannan gwaje-gwaje. Na gode.
Okay. He talked about the importance of premarital screening. What premarital screening is all about is a series of tests done by intending couple before they marry, so as to prevent the occurrence of some transmissible and inheritable diseases. Those transmissible diseases include HIV and Hepatitis B and C. And inheritable disease, the common example here in this environment is sickle cell disease. The test is usually done by collecting blood from both the intending husband and the wife. And the primary importance of this test is to prevent the occurrence of these diseases, because their occurrence can lead to myriad of problems, including financial burdens to the family, most especially in the case of sickle cell disease. There is also social problems, health problems, psychological problems due to frequent hospitalization and all the other negative impacts of the disease. And the other ones, HIV and hepatitis, also have the same problem, and so also that issue of blame game. A husband will be blaming his wife, and the wife will be blaming the husband as which one of them transmit the disease to the other. And in summary, it is very important to do those tests before getting married, so as to protect yourself, your spouse, and your offspring. Thank you.
Ụtụtụ ọma, daalụnụ. Aha m bụ Alụmakachukwu Christian. Otu a anyị ga-ekwu gbasara ahụike a na-akpọ glaucoma n'Igbo. So ihe anyị ga-ajụ gịnị bụ ọrịa glaucoma? Ọrịa glaucoma bụ ọrịa nke anya nke na-adị na-emetụta akwara niile ndị nke dị n'anya. Ihe na-adị na-ebute ọrịa akwara niile dị n'anya anụ anyị nwụsị bụ ọ bụ na enwe ihe a na-akpọ mgbali elu, ihe a na-akpọ pressure nke dị n'anya. So ihe anụ a bụ ihe dị na-aka ọsọ ọrịa glaucoma. So ihe ọzọ anyị ga-ekwu okwu ya kịta bụ gbasara bụ na ihe ọzọ anyị ga-amara bụ na ọrịa glaucoma bụ ọrịa ndị nke kacha eme ụmụ mmadụ ka abụ ndị kpụ isi. So ihe na-ebute ọrịa glaucoma bụ nke mbụ bụ na ọ na-adị na-esi n'agbụrụ. O si na ọ bụrụ na ị bụ na nna gị wee ọrịa glaucoma, ihe dịka ụmụ ya ma ndị ọzọ amụpụtakwara ga-enwe ike iri ya. Then ihe ọzọ na-adị na-aka ọzọkwa ọrịa glaucoma bụ ọ bụ na onye ọbụla wee akụ anya ma were anya kụọ n'ihe ọbụla siri ike, ihe dịka ochie ma ọ bụ ụzọ ma onye ndị ọbụla, ma ọ bụrụ onye apịara ọkpọ n'anya, ihe ndị a niile na-aka ọzọkwa glaucoma. Ihe ọzọ ga-abụkwa ọ bụ na onye nwere ọrịa mamịrị ma ọ bụ ọrịa ọbara, ọrịa mamịrị ma ọ bụ ọrịa shuga, ihe ndị a niile na-adị na-aka ọsọkwa ọrịa glaucoma. So ihe ga-aka mma bụ otu anụ anyị si wee bụrụ ndị Igbo, ọ ga-aka mma onye ọbụla were ọbụla ịmata na anya gị adịghị afụchazi ka isi afụbu mgbe nke ọzọ, ọ ga-aka mma ka ị wee gaa n'ụlọ ọgwụ a na-akpọ eye clinic ọbụla nọ na ebe ị nọ, ka ị wee fụ dọkịta ka a wee mara ihe kpatara ihe ndị a niile, ma mara ọgwụ a ga-enye gị ka ọ wee dị mma. So ọ ya bụ ya ga-ekwu n'okwu n'otu a. Daalụ.
Good morning, everyone. I'm Chukwumesi by name, and this morning we are going to be talking about glaucoma, the causes, and some medical advice on it. Now, glaucoma could be said to be an eye problem that is caused by the diseases on the optic nerves supplying the eye. This is often caused by an abnormally high pressure in the eye, like you hitting your eye on hard surfaces and so on. Now, glaucoma is one of the leading causes of blindness in Africa and Nigeria as a whole. Now, glaucoma could be hereditary, which means that affected parents could transmit this disease to their children. And also, as I said earlier, hitting your eyes on hard surfaces like table, chair, door, and all that, and also sustaining a blow or an injury on the eye will also cause this glaucoma. Now, medical conditions like diabetes, heart pressures, and heart problems, and so on could also be risk factors. Now, these are advice to you. If you're having a blurring vision, and so on, immediately consult a specialist hospital, maybe eye clinic and so on, for checkups and possibly medications to avoid glaucoma, which is a very deadly disease. Thank you.
Thank you so much.
Today, you get wetin I wan teach you. I wan tell you about lactose intolerance. Lactose intolerance na the disorder of carbohydrate digestion and absorption. Lactose na the disaccharide sugar wey dey inside milk. And another name for lactose intolerance, they call am milk intolerance. So if you hear milk, no say na lactose they talk about. Wetin dey cause this lactose intolerance be say e get enzyme wey they call lactase. This lactase na dey responsible to dey break down the milk wey we take for inside our body, so that our body go fit make use of the nutrients. So when this enzyme lactase no dey in enough amount for inside person body, or e no dey patapata, e go come cause lactose intolerance. Wetin go come happen be say this milk go come gather for person large intestine, and when e gather for person large intestine, bacteria go come act on am. Then e go come produce wetin dey call bacterial fermentation. Then you go come produce carbon dioxide, hydrogen gas, and 2 and 3 carbon metabolites. And when these ones when they come produce these ones, e get some kind symptoms wey the person go dey see, like dehydration. Dehydration na when person no get water for inside im body. Another symptom like they call diarrhea. Diarrhea na when person go dey shit well, shit water shit. Another one na flatulence. Flatulence when person belle go come big because of those gas. Another one na abdominal cramps. Abdominal cramps when the lower part of person belle go dey pain am. Now, this lactase deficiency, they fit classify am under primary, secondary, congenital, and developmental. When e be primary, na when e dey hereditary. Now, children wey they get that one, they go inherit am from their fathers, from their lineage. Now, secondary, now when the secondary own be say when person go get wound for inside the wall wey dey inside im belle, as a result of infection. It can be viral or non-viral infection. The why congenital, when they born newborn baby, the moment they start to give am breast new, the person will get that lactose intolerance. Now when that one that they call congenital, why developmental, they happen to children when they born premature, especially when they born them below 34 weeks, children when they born premature, that one they happen to them. But one thing be that one be say after some time as they grow, that one the thing go there, go disappear, everything will come there all right. Now the treatment for this lactose intolerance depend on which one they do you. The thing be say you go avoid food where milk dey inside, or you reduce the amount of milk wey you dey take. Hope say you understand wetin I dey talk. Thank
Day. I'm Rejoice, and the topic for today is lactose intolerance. Lactose intolerance can also be called milk intolerance. Lactose intolerance is caused as a deficiency of the enzyme lactase, which causes undigested lactose to accumulate in the large intestine. Bacterial fermentation takes place in the large intestine, giving rise to carbon dioxide, hydrogen gas, 2 and 3 carbon metabolites. Symptoms of lactose intolerance are dehydration, diarrhea, flatulence, abdominal cramps, etc. Lactase deficiency can be classified as primary, secondary, congenital, and developmental. Treatment for lactase deficiency is the removal of milk from diet or the reduction of milk from your diet. Lactase deficiency could also be hereditary or as a result of injuries to the mucosa of the stomach. Thank you.
Hi, my name is Ode Beniza Akachukwu, a 300 level student of medicine, University of Ibadan. And here with me is Sonto Madokachi, a 100 level physiology student, University of Nigeria, the only university in Nigeria.
Hello.
So today we'll be educating you on a medical condition called depression. I'll take it in Igbo language, she'll take it in English. In Igbo language, depression is called Obi Idamba. Obi Idamba bụ ọrịa iche echiche nke na-ebutekarị igbu onwe ma ọ bụ nkwarụ. Mmadụ enweghị aghọrị na obi ịdamba abụghị otu ihe. Ọ dịkwa nghọta atọ nke ndị nwere ọrịa bụ obi ịdamba na-enwekarị. Ha gụnyere nghọta ma ọ bụ ịhụta onwe ha dịka ndị na-abaghị uru ọbụla, ịhụta ụwa dịka ebe jọgburu onwe ya, ma ọ bụ ịhụta ọdịnihu a dịka nke na-enweghị olileanya ọbụla. Eleghị anya, COVID-19 emeela ka ọrịa bụ obi ịdamba banyewe ụba, n'ihi na o mere ka ọtụtụ ndị mmadụ tọgbọọ n'efu. Ya mere, ọ bụrụ na ị na-ahụ onwe gị na ị na-enwe nghọta dị otu a, ịbụ onye kwesịrị ka enyere gị aka. Ọtụtụ ihe bie na-ebute ọrịa bụ obi ịdamba, nke gụnyere nketa site na nwata, nsogbu ma ọ bụ enweghị mmetụta uche na mbido ndụ nke nwatakịrị, nsogbu dị iche iche nke a na-ahụ n'ụwa nke gụnyere ọrịa ma ọ bụ nsogbu nke mmiri na-eje ozi n'arụ mmadụ nke ndị bekee kpọrọ hormone ya na neurotransmitter. Ọ dị ụzọ abụọ a ga-eji jikwaa ọrịa bụ obi ịdamba, nke gụnyere ọgwụ mgbochi nke ndị bekee kpọrọ antidepressant ma ọ bụ site n'enyemaka nke onye ọrụ ahụike ya na ndụmọdụ ya. Ndụmọdụ m n'ụbọchị taa bụ na obi ịdamba adịghị iche na ọrịa ndị ọzọ dịka kansa. Ya mere, ọ bụrụ na ị na-ahụta onwe gị n'ọnọdụ a, chọọ enyemaka ngwa ngwa, n'ihi na eme ngwa emeghara ọdachi. Imeela.
Okay, thank you. Depression is a mental illness that is a major cause of suicide and disability. It is different from just feeling sad. 3 major mindsets seen in depression are negative views of self, of the world, and of the future that manifests itself in thoughts such as I'm no good, the world is an awful place, or the future is hopeless. So if you see yourself having any of those thoughts, then you might need help. And perhaps the COVID-19 lockdown worsened the problem because people had more time to be idle and think. Causes of depression include genetic predisposition, early life adversity or emotional deprivation, stressful life events such as illness, some hormonal or neurotransmitter disorders. Depression can be managed in two ways. 1. Drug treatment with antidepressants. 2. Psychological treatment by interacting with a specialist doctor. My advice is don't shy away from depression. If you are having any symptoms of depression, talk about it. It is just like any other medical condition, just such as cancer. Therefore, talk about it to get solutions as soon as possible. And do not resort to harmful remedies. Thank you.
So thank you very much for listening to us. Bye.
Bye.
Good day, my name is Natejuri Napoleon and I'm a medical student for UI. You get one topic when I want to follow this my guy here discuss. Now what they call the management of HIV for pregnancy, because this HIV so it affects many pregnant women for Africa, and many pregnant women they don't know what they will do. And this HIV they get the way when they get them, they get them through sexual intercourse, they also they get them through needle injury, and then they get them when them give them infected blood. Now, a good thing that they screen this HIV, good thing that they screen this pregnant women well, because now only when you screen this pregnant women well, you know whether they get HIV, so that they don't go fit pass the HIV, go give their pikin. Now, this screening don't reduce the transmission of the HIV well, and it also gets some things where you go do. We go make sure say they don't get HIV. We go make sure say the pikin don't get HIV. Some of these things we say you no go breastfeed the child after you don't born the child, and you no go give birth to the child through the vagina. Especially when the mama HIV dey high, when the mama viral load for the body dey high, and also you go give the mama drugs when we go people don't call antiretroviral therapy, so that it go reduce the HIV count, the viral count, yes. And we get when you go give this drug to the mama, and between 28 and what? Between the 28 and the 32 weeks of the belly of the pregnancy, now you go take him this something. And you get some situations where you go fit deliver through the vagina, and you get situations where you no go fit deliver through the vagina. You go fit deliver through the vagina when the mama viral load dey very low. Usually you go call am say when e dey less than 50 copies per mil, but if e dey more than 50 copies per mil, you go do what you go don call cesarean section, dem dey call am CS. And if the mama get hepatitis C infection, na one another ogbonge infection. If the mama get hepatitis C infection join the HIV infection, you go do cesarean section too. And if the mama dey on drugs, if the mama dey take zidovudine during delivery, you go also do cesarean section. And if the mama viral load come high you come high reach that kind 1,000 mils, you go say you go give the mama zidovudine o, and this zidovudine you go put am through the mama vein intravenously, you go call am intravenously. You give am through the veins, and you go also do cesarean section for that level. And people after you don born this pikin, you get things wey you go do o. You have to know whether the pikin get this HIV. You go give the pikin zidovudine for like 4 to 6 weeks. Go give am so that if you get HIV, you go reduce am, you go stop am. Then after you don give the pikin this zidovudine for like 4 to 6 weeks, you go like test the pikin o, so that your heart go dey gidigba, you no go dey fear. You go test the pikin for birth. After as you just dey born the pikin, you go test the pikin for birth. Then after you don test am for birth, you go go test am for 3 weeks age. After 3 weeks, you go test am for 6 weeks. Then after 6 weeks, you go test am for what? 6 months. And the way when you go take dey do this testing na wetin dem dey call PCR o, polymerase chain reaction. My people, na thank you. My brother here go explain to una for English. So yeah, give them.
So basically what my friend is talking about is how to manage the transmission of HIV between mother and child. Now, there are different steps and ways to manage the disease for the mother and also for the child. Now for the mother, when the mother is pregnant, the first of all do is screening to determine whether the mother is actually infected with the HIV virus. Now, if you are able to determine whether the woman is also infected, you now also determine the load of the HIV virus in the mother. If there are steps whereby if the load is very high, let me say above 50 copies per mil, there are steps you will take. If it's above that, there are steps you take concerning that. Now, if before the woman is put to bed, she'll be given antiretroviral therapy using the zidovudin to determine when so that be able to get this virus. Now, also when the woman has given birth, you do what they call exclusive breastfeeding, whereby you will not breastfeed the child for about 6 months. Also, on the mother, if the mother before the mother gives birth, you also determine whether you are going to do vaginal or cesarean delivery. So if there are stages whereby there are steps you to consider before you give that vaginal or cesarean delivery, cesarean section delivery. Now, if the mother, if you are able to determine that the load of HIV, the pregnant woman's body is not up to 50 copies per mil, you can do vaginal discharge. But if it's above 50 ml, you have to do cesarean section. Also, if the woman has hepatitis C, you have to also do cesarean section delivery. Now, if you now find out that the woman has a viral load of more than 1,000 copies per ml, you have to inject the woman intravenously during delivery. That is cesarean section delivery with zidovudin. Now, on the child, once you have to carry out a test, a PCR test, to determine whether this child, if the test is carried out at birth, 6 weeks, 3 weeks, 6 months. Now, if the child has this virus, you have to give them. You have to also administer zidovudin for the child.
You must give zidovudin whether or not.
Okay, whether or not the child 6 to 6 weeks. That's all. Thank you.
My people, thank you. Hope so Nigerian. I beg like this video. Thank you.
Ibosa, Iyere blessing na matemeso. Iri opu derida wari mwatoku. Ani ere University of Calabar. Mi dede wadugo pre yela obi. Ara ere bese matemeso.
Good morning. She is Blessing Amatemeso, a student of the University of Calabar, and I am Bessie Amatemeso, and will be talking to you about cervical cancer in the Okirika language, a language of the Rakuke people of Rivers State, Nigeria.
Yela obi.
Cervical cancer.
Yes, Saki. Mi obi mi ane yela mi kongo mi bufakama me. Ane kala puna senya puna bufakama me.
Introduction. Cervical cancer is a disease that affects a part of the womb called the neck, which is the cervix. It can affect anybody, both young and old.
Ani chinchinye. Body obi mi chinchinye virus, ani HPV, human papilloma virus, ani obona, erembona, bolomasiki, ani mi obi mi chinchinye.
Cause. It is caused by a virus called the HPV, which is the human papilloma virus that is sexually transmitted.
Mia imembioku. Baka pubo ani be paka diki paka make. Ani bo ojube sime bolosan won bebe. Isaki siri obi bo piki na ikoku fuka bo konju fuka.
Symptoms. In the early stages, many people do not have any symptom. But in later stages, you can have instrumental bleeding, which is bleeding that is between menstruation, pelvic pain and back pain, and a swelling in the vagina.
Ani bo iyojube wa samasa won bebe. Ibo fuku be. If
it has spread, you have weight loss, tiredness, and swollen legs.
Gobioku. Imuo mi obi wan sansan bebe. Ise gobi abara ani operation.
Treatment. Once you have the cancer, the treatment is surgery.
Miye mi obi mi sobi abara. Mi obi mi ineda mebi ani lama anibo bolosiki okima teremi ojumu ani pakabo. I test 1 year base ani dokibo. Mi test ere ani pap smear. Pap smear mi bugu ani mi goye ineda ani be. Erembo goye si boro finji. Kura mola ye goye mi test mi 1 year. Tere kura boro sam bebe apiki telema dikiye.
Treatment. Cervical cancer can be prevented. It takes a long time to develop. A test to screen for it is called the pap smear. Pap smear can be done at any health center. Every woman from 21 years should do it every 3 months if it is normal. It picks an early stage that can be treated.
Eremini esene kura okimu inye faswe kura inedi vasi mu oki mi obimi rila kebebe.
It also has a vaccine. Women between the age of 6 to 26 years can take the vaccine if they are not infected.
Mama ari inedi mebi isarasara ma mi obi yena. Sigareti bu ori bara obarase pilife bu bakasiki mesimeko.
Risk factors. Apart from the virus, there are things that can make a woman liable to get it, which are smoking, oral contraceptives, and multiple pregnancies.
Mingba mus pap smear muye.
Do a pap smear today.
Nebaka.
Thank you.
Good morning. I want to talk about what they call pneumonia. Some people they call pneumonia cold, but pneumonia not be cold. Pneumonia is an infection or disease where they affect the lungs, where they use breathe. If pneumonia enter your lungs, the way they use breathe will change. You go they get fever, you go they get cough. Pneumonia fit affects everybody of every age, but pneumonia that affects children more, and pneumonia they kill children well, past having they kill adults. Pneumonia, within ficus pneumonia now within some things what they call bacteria and viruses. If these things enter your lungs, they go cause what they call reaction, they go come affect how they take breathe. What's in a talk?
Good morning. We are here to talk about pneumonia. Pneumonia is a disease that affects the lungs, and it can be caused by bacteria and viruses. If it should enter your lungs, it will bring reactions that will bring like mostly deaths to mostly children. Like it kills children more than how it kills adults. So if we have symptoms like we have difficulty in breathing or something like that, make sure you visit your doctor. Thank you.
If you get any of these symptoms what I don't talk about, try make you go see your doctor. Maka pneumonia is the key word.
Good morning, everybody. My name is Jane Frances Amarachi Ogoki, and I'm a medical student of UNN. I'm here with my patients,
Blessing Precious,
and together we'll be teaching you about a disease called malaria. I'll speak in my local dialect, Igbo, while she speaks in English language. Thank you. So, one other Precious, Kekimera.
and the woman.
Achọrọ m ịgwa gị maka ọrịa na-akpọ malaria, nke ndị Igbo na-akpọ ọrịa ịba. Ọrịa ịba bụ ọrịa nkịtị, mana ọ na-egbukwa ọtụtụ ndị mmadụ, ọ kachasị na Afrịka. Ihe na-ebute ọrịa ịba bụ ahụhụ a na-akpọ anwụnta, nke ndị bekee na-akpọ mosquito. Anwụnta taa gị, ọ ga-ebunye gị ihe a na-akpọ nje plasmodium. Plasmodium a bụ ya ga-eje n'ime ọbara gị mezie gị ịrawa ọrịa ịba. Plasmodium a enwere ụdị plasmodium anọ nwere ike ibunye mmadụ ọrịa ịba. Ha gụnyere Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, na Plasmodium malariae. Mana nke kachasị njọ nwere ike ibute ọnwụ bụ Plasmodium falciparum. Ugbu a, ihe nwere ike ime iji gbochie ọrịa ịba bụ na ị ga na-ehi na ugbu anwụnta nke ndị bekee na-akpọ mosquito net, nke eji ọgwụ anwụnta wee gwọọ ka inwe ike gbochie anwụnta ịbịa taa gị bunye gị nje plasmodium. Nke ọzọ bụ na ị ga na-eyi uwe ogologo mgbe ọbụla ị nọ n'ezi n'abalị ka o nwee ike kpuchie gị ahụ gị, aka gị n'ụkwụ gị ka mosquito hapụ ịbịa taa gị. Nke atọ bụ na ọ na ebe ibi nwere mmiri dọrọ adọrọ, maka na anwụnta na-amụba ebe mmiri dọrọ, ebe mmiri na-adịghị ọcha bịa dọrọ. So ọ na-enwe ka isi nwee mmiri dọrọ adọrọ n'akụkụ be gị ma ọ n'ebe ibi, ị ga-agba mbọ hụ na iwepụrụ ya ka anwụnta hapụ ihu ebe ọ ga-anọ na-amụba wee bịa na-ata gị bunye gị nje plasmodium. Ihe ọzọ ị gakwa na-eme bụ na ị ga na-agba ọgwụ anwụnta n'ụlọ gị, ebe ị na-ehi ụra, n'akụkụ be gị, ebe niile, ka ị nwee ike hụ na igbochisiere anwụnta niile nọ n'ebe ahụ. Ọzịkwa na enwe ka o si mee, ọ bụrụ na imecha ihe niile ị ka butekwa ọrịa ịba nke bụ malaria. Ihe ị ga-eme bụ na ị ga-aga n'ụlọ ọgwụ gaa hụ dọkịta gị ka enwe ike nyocha gị ahụ ma nyekwana ọgwụ kwesịrị ekwesị. Ndewo. Now she will say everything I have said in English language.
Okay, I'm going to translate. Malaria is a common disease and it is most deadly, especially here in Africa. And it is caused by the Anopheles mosquito. This Anopheles mosquito has a parasite in them called Plasmodium. And there are 4 different kinds of this Plasmodium. The first one is Plasmodium falciparum, the second one is Plasmodium vivax, the third one is Plasmodium ovale, and the fourth one is Plasmodium malariae. But the deadliest form of this malaria is Plasmodium falciparum. And the prevention of this malaria parasite is you sleeping under an intact mosquito nest that must be treated with an insecticide, using mosquito spray, then wearing long clothing on your body and on your wearing long trousers also to prevent this mosquito bites, and also staying away from swampy and stagnant waters. Then if you have any symptom of this disease, it is advised that you go to the hospital. Thank you.
Ahamobo Mwakpara Chukwuka Moses Chidi. Ebe a nnọta abịara m ịkụziri onye mụ na ya nọ maka ọrịa nke a na-akpọ ọrịa pneumonia n'Igbo. Ihe a na-akpọ ya ọrịa oyi. Ọrịa pneumonia bụ ọrịa na-emetụta nke ume maọbụ nke ume nke mmadụ, ya bụ lungs. Ọrịa anụwa bata na ngụ mmadụ, ọ ga-emerụ ya, o merụọ ya, o mezie ka mmiri dọrọ n'ime akpa ume nke a na-akpọ alveoli. Mmiri adozi ebe a ga-emezi iku ume esiere onye ahụ ike. Gịnị bụ ihe na-ebute ọrịa pneumonia? That is causes. Enwere viral pneumonia nke bụ virus na-ebute ya, nje nke virus. Enwere nje nke bacteria, enwere nje nke fungi. Nje nke virus na nje nke bacteria enwere ike inweta ya site na mmekọrịta mmadụ na ibe ya. Enwere ike onye nke bụ ọrịa pneumonia nwere ike ịkwa ụkwara maọbụ zee uzere ebe ndị mmadụ nọ, ya ikuku eburuzie ihe ahụ ọ zere bujere ya ndị ya enweghị ya enweta ọrịa pneumonia. Ọzọkwa dịka ịbịa bụ nke fungi, nke a bụ site na gburugburu mmadụ ka esi enweta ya. Gịnị bụ ihe ngosipụta nke ọrịa pneumonia? That symptoms. Ihe ngosipụta ya nke mbụ bụ ịkwa oke ụkwara nke ihe na-akwapụta na-esi ike. Nke abụọ bụ obi mgbu. Nke ịtọ bụ anaghị eku ume ọfụma, wee dịrịzie emegide gabazie. Kedu ka esi egbochi ọrịa pneumonia? Nke mbụ bụ vaccination, ya ije ịgba ọgwụ mgbochi. Nke abụọ bụ imechi mmiri na ọnụ gị ma ị na-akwa ụkwara, ọkachasị ma ị bụrụ onye bu ọrịa pneumonia ka ị ghara ibunye ya ndị ọzọ. Nke ịtọ bụ ọ bụrụ ndị na-aṅụ oke anwụrụ amegide ha akwụsị ịṅụ ya maka anwụrụ ahụ na-emebikwa ngụ mmadụ. Nke ịnọ bụ idebe gburugburu gị niile ọcha. Ọ bụrụzie na ịbụ onye nke bụ ọrịa pneumonia ebu, ị nwere ike jee na nke dọkịta oyibo ka ọ gwa gị ihe nwere ike ime. Ndewo, kọwara ya n'Igbo.
Now, pneumonia is an infection in one or both lungs. Now, this infection causes inflammation in the air sacs, which is the alveoli. And then, this inflammation causes accumulation of fluid in the lungs, making it difficult to breathe. Now, what causes pneumonia? Pneumonia is caused by viruses, fungi, and bacteria. Now, the viral and the bacterial pneumonia are contagious. That is, they can be spread from person to person, while the fungal pneumonia is just from the environment. Then what are the symptoms of pneumonia? We have shortness of breath, we have coughing, we have tiredness, and so on. Now, how can we prevent pneumonia? Vaccination. Now close your mouth while sneezing, and then good hygiene. Now for the smokers, they should quit smoking. And then if you already have that pneumonia, you go see a doctor. Thank you.
Inside this morning, we will talk about what they call congestive heart failure. Congestive heart failure. What mean congestive heart failure? Now when that thing within inside your heart, when they pump blood, you know if you pump blood to all parts of your body. You get the right-sided part, you get the right-sided, left-sided side. That means you get right-sided wahala and left-sided wahala for your heart. Now, what will be the causes? Number 1, long-standing hypertension. You don't get hypertension day. Number 2, atherosclerosis. You don't too much fat and oil, you don't too much oil. Because of that, you don't cluster inside your vessels. Number 3, now waiting. Aortic stenosis. That thing, that big pipe will carry blood go up out of your body, you don't reduce for size. Number 4, now waiting. Heart defect. For here, that thing will divide your heart into 2, whole day for the middle. Because of that, blood will walk inside your body, you no go stay one place. So signs and symptoms. Number 1, all your body go dey fat, your body go swell, your face, your hand, your mouth, everything go dey swell. Number 2 na wetin? Heart enlargement, liver enlargement. Your liver go full, you go big, total go dey pain you. Number 3, your abdomen go big, your belle you go fat. Number 4, you no go fit breathe well, you go dey struggle to breathe. Good. How you fit treat this thing? You go use drugs. Drugs like wetin? ACE inhibitors, diuretics. These drugs dem go reduce the fat wey dey for your body, dem go reduce the swelling wey dey for your body.
Good morning, everybody. We'll be speaking on the topic congestive heart failure. What is congestive heart failure? This is when the heart cannot pump blood to all parts of the body. And we have the right-sided heart failure and the left-sided heart failure. Causes of congestive heart failure: we have long-standing hypertension. This is when you've had hypertension for a very long time. Number 2, we have atherosclerosis. This is when you've had so much fat and oil in your body, so it clusters in the vessel taking blood to your heart, and then it gives minimal flow of blood to the heart. Number 3, we have aortic stenosis. Aortic stenosis is when the great vessel that takes blood to all parts of the body is narrowed. Number 4, we have heart defect. Heart defect is when there are holes in the wall that separate the right side of the heart from the left side of the heart. What are the signs and symptoms of this congestive heart failure? We have edema. This is when fluid are all over your body, and then you have fluid. It swells. This is the swelling of your body. Number 2, we have enlargement of the liver. This is when your liver enlarges because of too much fluid in it. Number 3, we have enlargement of your stomach. Your stomach enlarges because of the fluid spill into your abdomen. Your abdomen rather enlarges because of the fluid from your liver spills into your abdomen. Number 4, we have difficulty in breathing. This happens because blood from the heart cannot get to the lungs. Now we have treatment for this. We have diuretics and we have ACE inhibitors. These drugs rather will help to remove excess fluids in your body. Thank you.
Good morning to you. Good morning, everyone. My name is Isaac Melchizedek Satumari. I'm with my friend Aliu Adamu. We are here to present on a disease condition called chronic kidney disease. I will be speaking in my local dialect and he will be helping out in the interpretation. Chronic kidney disease a Hausance wannan ciwon koda ne wanda yakan wuce watanni uku.
Chronic kidney disease is defined as long-standing kidney problem that has lasted for 3 months or above.
A takaice akwai abubuwa da yawan da sukan kawo wannan ciwon koda wanda ake kira chronic kidney disease. Amma duk wannan discussion zamu yi magana ne akan guda biyu wanda sun fi muhimma, wato hypertension wanda ake kira hawan jini da kuma ciwon sugar.
The etiology of chronic kidney disease are many, but for the sake of this discussion and the peculiarity in our environment, there are 2 main causes of chronic kidney disease, which include hypertension and diabetes.
Epidemiologically, wato a takance yanayin duniya, wannan cuta ya fi yawa ne hypertension, wato yawan BP ya yawa shine ya fi causing wannan, ya fi kawo wannan cutan da ake kira chronic kidney disease a namu. Amma kuma a wayansu kasashen duniya diabetes ya fi kawo wannan cuta.
So worldwide, diabetes is known to be the most common cause of chronic kidney disease, and for second by hypertension. But in our environment, like earlier said, hypertension, but there are other causes of this chronic kidney disease like glomerulonephritis, NSAID nephropathy, and other.
Gwaje-gwajen da akan yi ma wanda ya zo da wannan cuta sun kunshi gwadon jini a duba yawan shugansa, akan gwada bipinsa a gan ko ya karu, akan kuma ɗauko hoto a duba yanayin kodan ko suna nan, akan yi kuma abin da ake kira electrolyte urea and creatinine wato EUC.
Investigation of these patients varies, and they follows the suspected cause of the chronic kidney disease, and this include taking blood sample for electrolyte, urea, and creatinine, the abdominal ultrasound scan for kidney size, then measuring blood pressure, though that one is examination, but can also be used for hypertension, to rule out hypertension, taking chest x-ray to look at the heart size under blood. Then blood, again, blood sample can also be taken for diabetes, for serum glucose.
Treatment na wannan cuta bisa ga abin da yake causing na yake kawo wannan cuta ne. In sugar, yawan sugar ne yakan causing wannan cuta, akan bada magungunan da zai rage sugar. In kuma hawan jini ne, akan bada magungunan da yakan rage wannan hawan jini.
The treatment of this ailment depends on the cause, and usually if it is hypertension, you treat the hypertension, and if it is diabetes, you control blood glucose, and other causes like NSAID nephropathy, you ask patient to stay away from those medication, and then you continue to monitor the patient.
To wannan cuta kuma akan kiyaye yanayin samun cutar nan ta bari wa'ansu yin wa'ansu abubuwan da ya kamata, ana zuwa exercise, ana cin abincin da ya kamata da sauransu.
Prevention of this particular problem is based on the risk factor the patient has, and therefore patients are advised to visit their hospital for clinical checkup.
Thank you all. As you see, this is a good condition that we have to always strive. We take care of ourselves. Thank you very much, the audience, and thank you, my good friend Ali. Thank you very much. Thank you all.
My name is Nupe, and I'll be talking with my mom here on typhoid fever and how to treat and prevent it. So I'll be using Pidgin English, Nigerian Pidgin. So this typhoid fever, you don't ever wonder what they cause typhoid fever?
They wonder well.
Okay.
Does anybody really make understand?
Okay, normally, typhoid fever is one kind bad sickness that they caused by Salmonella typhi bacteria, and it is very, very common for developed countries. It is very rare for developed countries, but for developing countries like the ones within Africa, it is very common. And one way they contact them now, contaminated food, water, or close contact with person with the infected. So if you see person with a sick, they get fever, it's good for you to me go to touch the person just like that. Especially because not be a family member.
Before they touch you?
No, not good.
Mm-hmm.
If you get typhoid fever from that person like that. Mm-hmm. So the symptoms include high fever, headache, stomach pain, and person still they get constipation. So all those ones are among the symptoms. And these people, most people they get this type of fever, they feel better after a few days. But some other ones feel can die from the complications if they do not get treatment. So they get vaccine for typhoid fever, but not to be that effective like that compared to vaccine for other diseases like polio. Mm-hmm. So, and other symptoms of typhoid fever are dizziness. The fever feel starts low. It go increase daily. In the morning, it go day low. In the night, it go increase. Yes. Then headache. Person feel get headache, feel get weakness and fatigue. He go dey always tired. They get muscle aches, go dey sweat, go dey get dry cough, loss of appetite, weight loss, and many other things. And one other thing where the person still get na diarrhea and constipation. Go dey go toilet all the time. If you get rash again.
For typhoid?
Yes, so.
I don't know before.
The symptoms are very, very many. Mm-hmm. Some feel get some symptoms, some feel not get them, but most people they get most of all these symptoms. Some of them, their stomach become extremely swollen. Mm-hmm. So, but for later illness, when they not going to treat the typhoid, if you don't worse, person itself go to get delirium. What's in the delirium? You know, they think straight.
Mm-hmm.
They misbehave.
So you see the cause.
So that one affects the brain. And the person feel they lie motionless and exhausted. You go just day like this, I go just day half closed, you go just day. You know they sleep, but you know feel work, you know feel do anything. They call that one typhoid state. That one when you don't worst.
But if person feel well, you then treat them again.
If you reach that stage, you still wear the treatment, but sometimes if you come already result of that complications. So if you get fever, it good make you see doctor. Once you get any signs or symptoms of all these things, see doctor immediately. Not go to take all these local meds like Igbo, all those things. Those ones will even cause more damage. And that thing, transmission where they transmit typhoid na fecal oral. Person will get a fish shit, go toilet, you no go flush am. So you now you can't shake the person. You can't use that same hand eat if you don't get typhoid from a person like that. So just like that, different methods. Even restaurants will not cook. Person will get typhoid cook. Go toilet, not flush am. You know wash your hand. Can't go use and take cook. Don't serve people for restaurant. Typhoid don't spread like that. So even some people self even know they sick, but they be typhoid carriers and get the typhoid for body. Those people will still spread them. So to prevent typhoid, you need to get safe and proper drinking water, sanitize the environment, make sure everything they clean. But although this thing they hard for Nigeria would do, because many places they dirty, but you go feel done. At least they try to keep your areas clean. And they wash your hands. Not they drink untreated, not they enter anywhere you see tap or type, but just they drink like that. Avoid raw fruit and vegetables. That raw fruit, if you don't use human being manure, human being feces as manure, that person if you don't get typhoid fever, you continue through that. If you don't cook, I know if you see the typhoid.
Okay, raw fruits. Mean don't ever cook. Mean raw vegetable. Okay.
Like for market, person if you get typhoid. And they eat hot food mostly, like when you go to restaurant, like hot beans. This I like hot beans already. But not make me talk and shit. Hot beans they help. And when you get typhoid, they try to, when you suspect you get typhoid, not they infect others, not they touch other people. They always wash your hand and avoid handling food. They use spoon to eat or different things, not they touch the food, even with that self. If you use fork and knife or all those things, they use them. So now be all about typhoid and how to prevent them. So I hope so you don't learn so.
I learn well, but before I think say na only bad water, bad environment they cause typhoid. I don't even know say person if you give another person.
Yes, if
Thank
you give another person.
You do well. I don't learn something.
Yes. So that is all. Thank you very much.
Thank you, do well.
I'm Dr. Temitope Afolabi from the University of Ibadan 200 level. Here is my patient, he's Mr. Nureni Raimi. He's been diagnosed with benign prostrate hyperplasia, and this morning I want to explain to him what benign prostrate hyperplasia is in the Yoruba language. Benign prostrate hyperplasia, òun ni àrùn tí à ń pè ní ìsétọ̀. Ìsétọ̀ yóò wọ́pọ̀ láàrin àwọn ọmọkùnrin tó bá ti tó bí 50 ọdún lọ sókè. Prostrate gland yìí ó wà lára gbogbo ọmọkùnrin pátápátá. Ó máa ń wà láàrin méjì bladder àti urethra. Ìyẹn ibi tí wọ́n ń gbé ìtọ̀ pamọ́ sí àti ibi tí ìtọ̀ ń gbà jáde. Tí prostate gland tó bá ti wá wú, ó máa wá jẹ́ kí àyè tí ìtọ̀ lè gbà jáde kí ó kéré. Ìyẹn ló máa ń fa ìsétọ̀ tí ènìyàn ò ní lè tọ̀ dáadáa.
Benign prostate hyperplasia or prostate enlargement. It is common among men above 50 years and above. Prostate gland is between the bladder and urethra. If this gland becomes enlarged, there will be constriction of the urethra, and this obstructs proper flow of urine.
Kò sí ohun kan pàtó tá lè tọ́ka sí wípé òun ló ń ṣe okùnfà ìsétọ̀ yìí, ṣùgbọ́n a gbàgbọ́ wípé bí ènìyàn bá ṣe ń dàgbà sí, àwọn àyípadà kọ̀ọ̀kan máa wà lágọ̀ọ́ ara ẹ̀ nípasẹ̀ àwọn hòmónù tí ó máa yí padà ní àgọ́ ara ẹ̀, èyí lè ṣokùnfà ìsétọ̀.
There is no specific cause for prostate enlargement. However, it is believed that hormonal changes that occur as men grow older is responsible for this.
Kí ni àwọn àpẹẹrẹ tá máa rí tá máa fi mọ̀ wípé ẹni yìí ó ṣeé ṣe kó ti ní ìsétọ̀? Ìtọ̀ ẹni náà kò ní já gerege, ìtọ̀ yóò máa jáde á tún dúró, á jáde á tún dúró, ìyẹn là ń pè ní ìsétọ̀. Kódà ibi tí ìtọ̀ ń gbé pamọ́ sí yẹn ó máa ṣe bíi pé ó ti kú ṣùgbọ́n ìtọ̀ yẹn kò ní jáde.
The symptoms that you observe when one's having disease that there will be need to urinate a lot. There will be need to stop and start urinating several times. There will be sensation that your bladder is full and urinary urgency.
Kí ni àwọn ìpèníjà tí a máa fojú kọ? Ó máa ń fa àrùn ibi tí ó ń gbé gbogbo ìtọ̀ jáde yẹn urinary tract infection. Kódà ìtọ̀ níbi bladder yẹn ó máa kún, ó lè má tún wá jáde rárá, ìyẹn tí à ń pè ní acute urinary infection. Eléyìí acute urinary retention yìí ó máa ń fà
tó jẹ́ wípé ìtọ̀ kò ní jáde rárá, ó máa ń fa kí ìsàlẹ̀ ikùn ó máa dùnyàn, bladder yẹn ó máa fò tó jẹ́ wípé èèyàn máa lè máa fi ọwọ́ kàn án, ó máa dẹ̀ ń fa ìnira tó pọ̀.
Complication. It could lead to urinary tract infection, acute urinary retention. This is sudden ability to pass any urine. It is associated with lower and abdominal pain, swelling of the bladder.
Àwọn ọ̀nà wo la ń gbà láti kojú ìsétọ̀? Àwọn láti bí ọgọ́rin ọdún ó máa ń da kí àwọn ènìyàn kan máa lọ fún àyẹ̀wò prostate gland, ìyẹn gbogbo àwọn ọkùnrin. Kódà àwọn oògùn kan wà nísìnyí tí ó yẹ pé ó lè dẹ́kun bí prostate yẹn bó ṣe tóbi tó máa ń jẹ́ kó kéré sí i. Nísìnyí a tún ti ń ṣe iṣẹ́ abẹ fún prostate yìí. Àwọn ìgbésí ayé kọ̀ọ̀kan náà wà bíi kéèyàn dẹ́kun ọtí mímu, bíi kéèyàn yé mu omi àmujù tó bá di pé èèyàn ti fẹ́ sùn, bíi kéèyàn máa ṣe iṣẹ́ tó máa ń jẹ́ kára dá yágáyágá, ìyẹn exercise lóòrèkóòrè, nítorí ọ̀rá tó bá pọ̀ jù lára náà ó lè fa prostate.
Treatment includes medication that shrinks the prostate, surgery, and also reducing intake of alcohol, and changes of some lifestyle, and exercising regularly, passing catheter to let out the urine, and drinking less in bathing.
Passing of catheter is also very important. Thank you very much.
Now, good morning,
Good morning, everyone.
My name na Faith Okoli, and with me here na Precious.
My name is Faith Okoli, and with me here is Precious.
Today we're going to talk about one disease wey English people dey call Hepatitis B.
Today we'll be speaking on a disease called Hepatitis B.
Hepatitis B na very serious infection of the liver wey no get cure.
Hepatitis B is a serious chronic infection of the liver.
You fit get Hepatitis B when this virus enter your body.
Hepatitis B is caused by a viral infection of the Hepatitis B virus.
E dey important say make we know about Hepatitis B because Nigeria follow for the country wey get am pass for the whole world.
It is important to know about this Hepatitis B because Nigeria is one of the countries with the highest rate of Hepatitis B virus.
Now, how you fit get am or how you fit give person?
Ways of transmission.
When body fluid from person wey get am enter your own body, you fit get am.
When a body fluid of an infected person enters the body, you can contact it.
E fit enter your body when you dey share needle.
You can contact it through sharing of needles.
When you dey get sex without protection.
Unprotected sex.
Mama wey get belle, she fit give her pikin wey dey her belle during childbirth.
An infected mother can give it to her unborn child during childbirth.
People wey dey work for hospital fit get am when this infected needle chook them.
Healthcare workers can also get it through infected stick injury.
When you dey travel go places where this Hepatitis B virus plenty, you ma fit get am.
Also, traveling to areas that Hepatitis B is common.
Wetin be the signs of hepatitis?
The symptoms.
E fit come without symptoms, but some people fit show some signs like
it can present without symptoms, but most people can experience.
Number 1, you no go get appetite to chop.
Number 1, loss of appetite.
Number 2, you go dey vomit.
Number 2, vomiting.
Number 3, you go weak well.
Number 3, weakness or fatigue.
Number 4, your piss go dey dark colored.
Number 4, dark colored urine.
Number 5, you go dey get pain for your joints.
Number 5, joint pain.
Number 6, you go dey get yellowness of your skin and eyes. Na wetin dem dey call jaundice.
Number 6, yellowness of the eyes and skin. This condition is known as jaundice.
Now, how doctor fit confirm say you get Hepatitis B?
Diagnosis.
Doctor go look you. He go check whether you get small fever.
Physical examination. The doctor will examine the patient and he or she may present with low grade fever.
If he get jaundice too.
Jaundice.
If he get big ascites wey big belle wey na water full in belle.
Ascites.
If he also present with wetin dem dey call caput medusa, that is the veins wey dey your belle go shoot out dey show.
Caput medusa, appearance of the engorged superficial abdominal vein.
Now, they fit run you some tests, some blood tests.
Number 2, blood test.
They fit also scan you. They fit do you ultrasound scan or computer tomography scan.
Number 3, ultrasound scan. 4, computer tomography scan.
They fit do you liver biopsy wey dem go comot small part of your liver to check am under microscope.
Number 5, liver biopsy, where a minute piece of your liver is collected and analyzed under a microscope.
How you fit prevent yourself from getting this hepatitis?
Prevention of hepatitis B.
When you dey get sex, use protection.
Protected sexual intercourse.
Number 2, no dey share needle.
Avoid sharing of needles.
Number 3, vaccinate yourself. Now, people wey dey travel and people wey dey sexually active suppose get this vaccination.
Travelers and sexually active people are supposed to go for vaccination.
Now, if you don already dey infected, no need to get this vaccine, but you fit go see your doctor so that they go prevent this disease make e no bad pass as e be.
Note that already infected people, and there is no need to take this vaccine. You just go to your doctor to prevent you from progressing.
Thank you. Now, well done. Oh.
Good morning, everyone. I'm Joseph Gbogbo, a third-year medical student at the University of Maiduguri. Today, I'll be talking on Alzheimer's disease in my native language, Yoruba, but most of the time, Pidgin English.
I'm Mrs. Bubo. Helen is mom. I'm a volunteer on the talk on Alzheimer's disease.
Thank you. So, disease in I see Alzheimer's organa or affect the ushorina. In essence, Alzheimer's disease na disease wey dey affect person brain. When e affect the brain, e dey cause cells, that's the neurons, which are the brain cells of the brain to dey degenerate and to dey die anyhow. Now, this disease, when e don affect the brain and don cause brain cells to die, e go come dey cause the person to dey forget anyhow, and the person no go dey behave how e suppose dey behave. Onyorin.
It is a disease that causes the degeneration of neurons, leading to memory loss and impaired brain functions.
Wow. Yes. You dey get am. Now, this disease, the main cause no dey known. Wetin dey actually dey make this thing, e no too dey known. But people wey don dey read book, wey dey go school, talk say when something wey dey call protein accumulate, not just protein, but amyloid protein and tau protein, when e accumulate for the brain, e go dey cause blockage of neurons. So when these neurons don block, dem no go dey pass their apropos information dey go. And this thing now, things wey fit cause this thing na age, if the person don get am for a family before, sickness wey dem dey call diabetes, and apart from that, when person no dey when you no dey exercise, doctor say make you wake up in the morning, do press up. No, when you wake up, you go dey take ice cream, dey take all these things. Now all these things fit cause this thing. Onyorin.
Yes, this disease is caused by the accumulation of proteins called amyloid and tau proteins. The risk factor include age, family history, diabetes, and lack of exercise.
You get am. That's very good. Now, when person get disease, how person take dey know say e get disease? Na through wetin the person go dey feel, or the signs wey person go dey see for the person body. For Alzheimer's disease, the main thing wey dey make people know say person get am na wetin? Forgetfulness, and when person no dey think and dey behave properly.
The symptoms include memory loss, cognitive impairment.
Nice. Now, treatment for this disease no dey. At all, the treatment no dey. Or when doctor dey give person drug and the person go dey exercise, e fit help prevent this kind bad disease wey dey affect people.
There's no definite treatment at all, but it can be managed by the medication prescribed by the specialist and physical exercise.
Yes, yes, you dey get am. In addition now, addition dey Pidgin o, but to now solidify this thing wey we don talk now, e go good make Nigerians and people at large for the world dey wetin, dey engage in physical activities, dey meet friends, dey relate, dey play sports, dey play football, dey chop good food. And in addition to all those ones now, person fit talk say e go fit wetin, prevent this thing wey dey affect our people. So
that is a lifestyle. Lifestyle activities like physical activities, social activities, and good diet can assist in preventing Alzheimer's disease.
Ndewo ọhaneze na-ege ntị. Ihe mmụta ahụike anyị ji bịa taa bụ ọya mgbakwa ọnụ nke nwa bekee na-akpọ meningitis. Kedu ihe bụ ọya mgbakwa ọnụ a? Ọya mgbakwa ọnụ bụ okpomọkụ a na-enweta n'ihe na-ekpuchi ụbụrụ maọbụ ide azụ. Kedu ihe nwere ike ibute ọya mgbakwa ọnụ a? Nje dị iche iche dịgasị ka nje virus maọbụ nje bacteria nakwazi nje fungi na nke parasite wee dere gawazie nwere ike ibute ọya mgbakwa ọnụ a. Ọ dịkwa mkpa ịmata na ọya mgbakwa ọnụ a bụ nke na-efe efe site na isi ụkwara, ize ihere maọbụ site na mmetụta onye bụ ya na onye ọzọ. Ụzọ ndị a ka o si nwee ike ife mmadụ. N'aka nke ọzọkwa, ọya mgbakwa ọnụ nke virus bụ nke na-eji aka ya na-arụ onwe ya, ọ bụgodị na onye bụ ya agaghị ụlọ ọgwụ ma ọ ṅụọ ọgwụ ọbụla. Mana ọya mgbakwa ọnụ nke bacteria bụ nke bụ na ọ bụ na onweghị ihe mere maka ya, ọ na-egbu onye ọbụla bụ ya. Ọ na-adị mkpa ka onye bụ ọya mgbakwa ọnụ bacteria gaa n'ọgwụ ma chọta enyemaka. Enwegasị ife dị iche iche mmadụ ga-enwe onwe maa na onwe ọya mgbakwa ọnụ, nke dịka oke isi ọwụwa, oke arụ ọkụ, ntụ oyi, ike ọgwụgwụ, arụ mgbakasị wee dere gawazie. Ife ndị a bụ ife mmadụ nwere ike inwe ọma na onwe ọya mgbakwa ọnụ. Enwekwazi ọgwụ mgbochi maka ọya mgbakwa ọnụ. Ọ dị mkpa na ị ga n'ụlọ ọgwụ dị gị nso ka ị wee mata ka esi egbochi ọya mgbakwa ọnụ. N'ikpeazụ, enwere olileanya maka ndị nwere ọya mgbakwa ọnụ maka na ewepụtachala ọtụtụ ọgwụ dị iche iche eji agwọ ya bụ ọya mgbakwa ọnụ, nke dịgasị ka nke nwa bekee kpọrọ antifungals, antibiotics maọbụ antiviral drugs. Ọ dịkwazị mkpa ka anyị mara na ahụike bụ ihe kachasị mkpa na ndụ mmadụ, maka na ahụike bụkwazi ahụike. Ndewo.
Today we are talking about meningitis. Meningitis is the inflammation of the meninges. The meninges are the three membranes that covers the brain and the spinal cord. We have some causes of meningitis. First is the bacterial and the viral causes of meningitis. Also, we have the parasitic and the fungal causes of meningitis. Alright, we also have some types of meningitis. The first and the most common of them is the viral meningitis. This is the most common in the society, and it doesn't require or it doesn't need any urgent treatment because it can go on its own easily. Also, we have the bacterial meningitis. This is the most deadly and the most fatal, and it becomes fatal if not attended to. Also, we have the fungal meningitis. This kind of meningitis, those with low or decreased health status are quickly or they are exposed to develop this kind of meningitis. And also, we have some certain symptoms of meningitis. First, we have cough, we have stiffness of neck, we have headaches, we have irritations, etc. Also, do we have a vaccine for this meningitis? Yes, of course. There have been some certain vaccines that have been stipulated for the treatment of meningitis. Okay? So meningitis can be treated with fungal drugs, antifungal drugs, antibiotic drugs, and then antiviral drugs. We all know that good health is important to mankind, and we can try as much as possible to keep our health checked. Okay? As they say, good health is good wealth. Thank you for listening.
Good day, everyone. My name is Udezine, 211 medical student of Nnamdi Azikiwe University, and with me here is my pseudo patient for today, Ferdinand Chidume. For today, we're going to be talking about infertility and assisted reproductive techniques. So, and I'll be speaking in Igbo and he'll be interpreting in English. So, to start, kedu ihe wu infertility? Infertility in Igbo pụtara amụghị nwa. Amụghị nwa wụ na this amụghị ha bụ just any amụghị ha, or just for a period of ofu arọ, nwaanyị rugoro oge ịmụ nwa na-emekwa ihe niile dị n'ịtụ ime ọ tụtara ime. Ọnọbụgodị na ọ tụtara ime, ọ mụtara nwa dị ndụ. Now, a na-akọwatara amụghị nwa n'ụzọ na-abụọ. Nke izizi wụ primary infertility. Ihe wụ primary infertility, that's nwaanyị rugoro oge ịmụ nwa na-emekwa ihe niile dị n'ịmụ nwa ma ọ tụtara ime. Ọnọbụgodị na ọ tụtara ime, dị nwa onwe miscarriage ma spontaneous abortion or na stillbirth. Ihe aka na-akpọ primary infertility. Secondary infertility pụtara na nwaanyị mụgoro nwa mgbe izizi na-atarakwa ihe niile dị n'ime nwa ma ọmụta nwa dị nwa. Onye ahụ na after a year ọmụtara dị nwa, onye aka na-akpọ secondary infertility. The next anyị akọ maka ya wụ male and female infertility. Maka ihe amụghị nwa na-apụta as a fault of both nwoke na both nwanyị. So ihe anyị akọ na male infertility, there were different factors na cause male infertility, and ihe a pụta as in could be as a result of deformity to the sperm, that's abnormal sperm shape. It could also be na the sperm anaghị emove ka o kwesịrị imove, ma ọ bụ na agụkọ ya ọnụ ọ naghị erute the number ọ kwesịrị iru, that's low sperm count. Enwekwa ike ọwụ na the mmepụta the sperm ọ naghị emepụta sperm ọfụma ọkwụghọta. So that ihe a bụ as in reasons why nwoke ya ga-adị infertile. Enwekwa ịkọta ya n'ụzọ na-abụọ, that is as acquired and genetic. Acquired wụ na the thing banyere ahụ from outside, mana genetic wụ na o si n'ime arụ ya na-eme. Now the genetic na ahụ as a result of chromosomal abnormalities or ihe na-akpọ Klinefelter syndrome or anti-sperm antibodies. Ụmụ ihe a bụ ihe na-akọsụ male infertility. Abịakwa na female infertility, nwaanyị na-enwekwa different things na-akọsụ ya female infertility. Ya wụ the same n'ụzọ na-abụkwa acquired and genetic. Acquired female infertility that as a result of different things like smoking, malnutrition, overweight, underweight, and all those kind of things. Ma abịakwa na genetic na-enwekwa different problems, the malformation of the uterus, na-enwekwa anovulation. Na ya wụ na nwaanyị anaghị eme ovulate ma ncha, and ọ naghị eme ovulate ma na-afụ period ya. Enwekwa different other things na-akọsụcha ihe a. So kekwana ihe a eji wee solve all this problem of infertility. Ihe a na-akpọ assisted reproductive techniques. Assisted reproductive techniques pụtara different ways a eji wee mee ka nwaanyị na-anaghị amụ nwa ka ọ tupu ime mụkwa nwa. And the most popular of all these techniques we have na-akpọ IVF. Makwa na before a procedure bụrụkwa an assisted reproductive technique, he has to deal with so ụmụ ihe a ya eme mekwa nwaanyị mekwa ihe nwoke. And it has to be outside the body. That reproduction has to be outside the body. In vitro. And so man dị n'ime arụ, the fertilization ama mezi n'ime arụ emezi outside the arụ. Onya wo ihe na-akpọ assisted reproductive technique. And of the most popular of us ihe na-akpọ in vitro fertilization. Onya wo na ha ewepụta the akwa dị n'ime nwaanyị, wepụtakwa sperm na arụ nwoke, tinye na petri dish wee mekwa ya ọnụ ka ọ dị fertilize. Ọ bụrụzi na embryo mekwa implant na nwaanyị ewepụta dị akwa n'ime ma ọ bụ na ahụ nwaanyị ọzọ. Onya wụ in vitro fertilization. So pseudo patients we akọwatalizi unu na oyibo ka unu mụtasịkwa ya ọfụma.
Okay, infertility is a disease of the reproductive system due to the failure of a couple, or let's say yes, a couple unable to give birth. And as a result of two factors, we have the primary and the secondary infertility. The primary infertility, the woman is unable to give birth or carry the baby to term, and this may be as a result of many factors or even miscarriages. The secondary infertility, a woman after giving birth before is unable to conceive or bear a child again. So infertility can be divided into two forms. You have the male infertility and the female infertility. The male infertility, as a result of a man unable to impregnate his fertile wife, We have two causes. We have the acquired cause and the genetic cause. The acquired cause as a result of low sperm count or abnormal shape of the sperm. Then the genetic aspect of it, you have the anti-sperm, and antibodies. You have the Klinefelter syndrome. In the female reproductive and the female infertility, we also have two causes. We have the acquired and the genetic. Acquired as a result of diseases or malformation of the uterus, etc. Then you have the genetic cause, which is as a result of mutation of genes, diminished ovarian reserve, or premature menopause. Then we go next to the remedies to these infertilities. We have what we call the assorted reproductive technology, which is as a result of trying to make the people pregnant. This is infertile people pregnant. You have the in vitro fertilization (IVF), which involves planting the male sperm and the female ovary, so that they can be able to give birth, and then later it can transport them into the female reproductive system, so that they can bear a child. Thank you.
You're welcome.
And I'll be doing a video with my patient. I'll be talking about something of public health importance, and I'll be speaking in a local language that cuts across people in my area. So I'll be speaking in Pidgin. This is my patient. Her name is
Grace.
Thank you very much, Madam. Today I want to tell you about premarital counseling and premarital laboratory investigation. These things are things where you're supposed to do before you marry. That's maybe you see person where you won't marry, or maybe you see person where you like, where you love, where you know say you could feel settled with. You go want do this investigation first, because see we don't want problems to happen. The sample they will take now your blood, then go take your blood, take your partner blood, they will do for 2 of now. So when you take your blood now, number 1 test they will do na genotype. Number 2 tests we they will do na blood group and Rhesus. Number 3 tests we will do na HIV. That genotype now, different genotype we dey na AA, AS, SS. Now for genotype dey very important, because if you be AS, the only person if you marry na AA. You understand? If you be AS, you're not supposed to marry AS. If you be AS, you're not supposed to marry SS. Because see, we won't try to prevent the incidents, the amount of people, children when they come down with SS. Fine, SS na sickler, and we they treat them, then they okay. But there are problems there. So even as we treat them, won't try to reduce the number of children who will get to be SS. You understand what I talk, madam? So now the second test we will do, now what we call blood group. Blood group now to know the type of blood where you get and type of blood where your husband gets. And that blood group, which is very important that for that this thing, when they do blood group, they will still do Rhesus. You know, say they tell you say it be O, they will tell you whether it be O positive or O negative. If you be O positive, it means say you get Rhesus antigen. If you be O negative, it means say you don't get Rhesus antigen. And now if you be O positive, if you be O negative, and your husband are O positive, after you born any pikin, you're supposed to tell your doctor say you be O negative and your husband are O positive. So that immediately you born, they will give you one injection, one medication. The name of that medication is Rogam. That thing it prevents make what they call antibody form for your body. So if the antibody, if you don't give that injection and that antibody form for your body, the next children when they will come with Rhesus positive, and that antibody don't form for your body, you can't affect those children. If you can't lead to what they call miscarriage inside pregnant. Madam, you know say you never won't get that kind of miscarriage. So now so it be. So you go do that genotype test, you go do blood group, you go do Rhesus antigen. And that test you go do na HIV. You go do for yourself, do for your husband, because no one make HIV go from one person to another person. Then if one partner na HIV positive, we will give the other partner, which we call pre-exposure prophylaxis. They call them PrEP, to prevent HIV. If the other one no gets
if they don't get HIV and you don't already dey exposed, we can't give them what we call post-exposure prophylaxis.
Okay.
But then you know, I don't talk.
But I want to ask you one question. That genotype and blood group wey dey talk, now only O positive and O negative na im dey.
You get all that blood groups with it. You get A, you get AB, you get B, you get O.
Okay.
You understand?
Okay.
So these things I don't talk everything. Explain them back to me. I know say you understand.
Okay, you said before somebody go marry, if you see somebody where like where you want marry, number one thing you go check your blood group, number two thing your genotype, number three thing your HIV status.
Yeah.
So when you check your blood group, you go know whether you get O positive or O negative. When you check your genotype, you know whether AA or SS, because SS no fit marry SS, and AS no fit marry AS. And your HIV status, when you check am, in case if your partner get, you know, get, we will give you one drug so you call that name to help you. And all the things we talk to that.
So madam, you sure say you go do am when you want marry?
I go come call you, may you do am.
No, thank you very